pressure. 6, X descent. This is a further descent that occurs due to the atrial relaxation and the downward movement of the atrial wall, helping to further decrease the atrial. These final components complete the characteristic jugular venous pulse and give us a full picture of the pressure changes in the right atrium throughout cardiac cycle. Let me know if there's anything else you'd like to explore.
Okay, like what are the pathologies?
No worries at all. It's a head help.
What are the pathologies of GBP?
No problem at all. To sum it up, the main pathologies of the JVP typically relate to abnormalities in the waves and descents. For instance, elevated A wave can indicate issues like tricuspid stenosis or right atrial enlargement. Prominent V wave can suggest tricuspid regurgitation, where blood leaks back into the atrium during ventricular systole. Exaggerated Y descent might point to conditions like constrictive pericarditis or severe tricuspid regurgitation. These help clinicians diagnose and understand underlying cardiac conditions. If you need more details on any specific pathology, just let me know.
Repeat it.
Of course, to recap the main pathologies of the JVP, an elevated A wave can indicate like tricuspid stenosis or right atrial enlargement. A prominent V wave often suggests tricuspid regurgitation, where blood leaks back into the atrium during ventricular systole. An exaggerated Y descent can point toward conditions like constrictive pericarditis or severe tricuspid regurgitation. Help in diagnosing and understanding various cardiac conditions. If there's anything else you'd like to
Repeat the
dive deeper into.
pathologies.
Absolutely. So in terms of pathologies related to the JVP, 1, elevated A wave. This can be seen in conditions like tricuspid stenosis, where there's increased resistance to blood flow into the right ventricle, or right atrial enlargement. Various causes like pulmonary hypertension. 2, prominent V wave. This often indicates tricuspid regurgitation, where blood flows backward into the right atrium during ventricular systole, leading to a large V wave. 3, exaggerated Y descent. This is often seen in conditions like constrictive pericarditis, where the pericardium restricts the heart's filling, or in severe tricuspid regurgitation. All these patterns help clinicians identify underlying cardiac issues and guide appropriate treatment. If you'd like more details,
Tujuh satu
absolutely, I'm glad to help.
This
Just
is
let me know
me.
if you have any other questions or if there's anything else you'd like to dive into. I'm here whenever you need. Anytime. If you have more questions in the future or need any more experts, just let me know. I'm always here to help. Have a great one.
There was also a diagram or something related to it, right?
Absolutely, diagrams definitely help visualize the concepts. If you have a specific diagram in mind,
Wait.
or if you'd like, no problem at all. Just let me know whenever you're ready, and I'm here to help with whatever you need. Feel free to let me know if you have.
How do PPAs work?
Sure, PPAs or positive pressure airway devices.
No. I'm saying PPI. Proton pump inhibitors.
Got it. Proton pump inhibitors or PPIs work by blocking the hydrogen potency of ATPase enzyme system in the stomach lining. This enzyme is essentially the final step in the production of gastric acid. By inhibiting it, PPIs effectively reduce the amount of acid the stomach produces, which aids in removing ulcers, managing GERD, and reducing symptoms of acid reflux. If you'd like more details, just let me know.
Yeah.
Absolutely. So PPIs work by binding to the proton pump in the parietal cells of the stomach lining. This pump is responsible for secreting hydrogen ions into the stomach, which combine with chloride to form hydrochloric acid. By inhibiting this pump, PPIs drastically reduce gastric acid secretion, leading to a higher pH in the stomach. This not only helps alleviate symptoms like heartburn and reflux, you'd like more in-depth info or have any specific questions, just let me know.
Okay, it's good.
Great. If you have any other questions or need more details on KPIs or anything else, just let me know. I'm always here to help.
And what about antihistamines?
Absolutely. Whenever you're ready or if there's something specific on your mind, just let me know. I'm here to help with
What about
whatever you need.
what about antihistamines?
Sure. When it comes to NDC or non-destructive testing, it's a range of techniques
No, no, no.
used to.
What is CTG? Demotriprazole.
Got it. So the cardiac biomarkers or CBGs generally refer to substances in the blood that are measured to help diagnose or assess heart conditions. For example, troponins are a key biomarker for heart muscle injury, and other markers like BNP can indicate heart failure. If you're looking for more detailed info on any specific cardiac biomarker or related topic, just let me know. I'm glad that brought a smile. If there's anything else you're curious about or anything specific you'd like to dive into, just let me know. I'm here to help and chat about whatever you need.
I am saying like what is chemotriprazole?
I see. Chemotrigger zones are areas in the brain that detect certain chemicals in the blood or cerebrospinal fluid. Most well known is the area postrema, located in the medulla. It's part of the vomiting center and contributing nausea and vomiting in response to toxins or other chemicals. This mechanism is really important for protecting the body from harmful substances. If you have more questions about that or anything else, just let me know.
Oh, I don't know about it.
Of course, the chemoreceptor trigger zone, CTZ, is a region in the brain that plays a crucial role in detecting toxins and chemical changes in the blood and cerebrospinal fluid. It's located in the area postrema of the medulla oblongata, and it doesn't have a normal blood-brain barrier. This allows it to detect toxins more readily. When the CTZ is activated, it sends signals to the vomiting center in the brain, leading to nausea and vomiting as a protective mechanism. If you'd like to know more details and have any specific questions, just let me know.
Okay, okay.
Awesome. If you have any more questions or if there's anything else you'd like to chat about, I'm here for it. Just let me know whenever you need.
Yep. Oh, what a gram negative and positive bacteria.
Sure, the main difference between gram-negative and gram-positive bacteria lies in their cell wall structure and how they react to the gram stain. Gram-positive bacteria have a thick plastic-like layer in their cell wall which retains the crystal violet stain during the gram staining process. This makes them appear purple under a microscope. Gram-negative bacteria, on the other hand, have thinner peptidic-like layer and an outer membrane. This outer membrane contains lipid polysaccharides, and because of this structure, gram-negative bacteria do not retain the crystal violet stain. Instead, they take up the counter stain and appear pink or red under a microscope. This difference is important not just for identification, but also for determining antibiotic sensitive and gram-positive bacteria often respond differently to antibiotics. If you have any more questions or need further details, just let me know.
What about the stain?
Absolutely. The gram stain is a fundamental technique.
Wait. GMSA.
Got it. The Giemsa stain is another important staining technique, often used in microbiology and hematology. It's particularly well known for staining blood smears and can help visualize parasites like those causing malaria, as well as different types of white blood cells. Giemsa staining highlights cellular details and is great for identifying various organisms and cell structures. If you'd like more details on that or anything else,
Yeah.
just let me know.
Oh, more details on that.
Gotcha, no problem at all. If you have any other questions or need
I want more information about game sustain.
Of course, the Guillaume stain is a type of Romanowski stain that's widely used in both clinical and research settings. It's particularly effective for staining blood smears and bone marrow samples. Guillaume stain works by binding to the phosphate groups of DNA and the acidic components of cellular organelles, giving distinct coloration. In hematology, it's commonly used to identify and differentiate between different types of white blood cells, and it's also vital for detecting parasites like Plasmodium, which causes malaria. This stain provides a clear contrast, making it easier to see cell morphology and any abnormalities. If you'd like more details or have specific questions, just let me know.
Like, what is used to stain tuberculosis?
Staining Mycobacterium tuberculosis, the most commonly used technique is the Zeal-Nielsen stain, which is also known as the acid-fast stain. This method uses a strong dye called carbofuchsin, which penetrates the waxy cell wall of the mycobacteria. After that, the sample is decolorized with acid alcohol, but the mycobacteria retain the red dye due to their lipid-rich cell walls. This makes them appear bright red against a blue background when viewed under a microscope. This technique is very effective for identifying tuberculosis bacteria in clinical samples. If you have more questions or want to explore further, just let me know.
What are acid-fast bacteria?
Acid-fast bacteria are a group of bacteria that have a waxy lipid-rich cell wall, which makes them resistant to decolorization by acid alcohol after staining. The most well-known acid-fast bacteria is Mycobacterium tuberculosis, the pathogen responsible for tuberculosis. Another example is Mycobacterium leprae, which causes leprosy. The acid-fast properties due to the high concentration of mycolic acids in their cell walls, which gives them their resistance to many standard stains and disinfectants. This trait is what makes the Zeal-Nielsen staining method particularly useful for identifying them. If you'd like more info, feel free to ask.
How do like how to test for tuberculosis?
Absolutely. Acid-fast bacteria are identified by their unique cell wall structure, which is rich in mycolic acids. This makes them resistant to conventional stains and requires special staining techniques like the Zeal-Nielsen stain. When you apply this stain, the acid-fast bacteria retain the red color even after being washed with acid alcohol, while non-acid-fast bacteria do not. This characteristic is what helps in diagnosing diseases like tuberculosis and leprosy. If you have more questions or want to dive deeper, just let me know.
What the anaerobic bacteria?
No worries at all. Whenever you're ready or have more questions, I'm here to help. Just let me know and we can explore anything we need.
And aerobic bacteria.
Absolutely. Aerobic bacteria are bacteria that require oxygen for their growth and survival. They use oxygen in their metabolic processes, specifically in aerobic respiration, to produce energy. Some common examples include Mycobacterium tuberculosis, Pseudomonas aeruginosa, and Staphylococcus aureus. They thrive in environments where oxygen is present and play crucial roles in various ecological and human health contexts. If you'd like more details or have any specific questions about them, feel free to ask.
Aerophilic bacteria.
Absolutely. Anaerobic bacteria are bacteria that do not require oxygen for growth and, in fact, may even find oxygen hard. No
So,
worries.
few examples of them.
Of course, some common examples of anaerobic bacteria include Clostridium botulinum, which causes botulism, Clostridium difficile, known for causing antibiotic-associated cheilitis, and Bacteroides fragilis, which is part of the normal gut flora but can cause infections if it escapes the intestines. Anaerobic bacteria are often found in environments with little to no oxygen, such as deep tissues, the gastrointestinal tract, and even the oral cavity. If you want to know more about any specific anaerobic No worries.
I don't know if he was a
I'm glad we could have a bit of fun. If there's anything else on your mind or if you have any questions, just let me know. I'm here to help whenever you need.
Teaching medicine.
Absolutely, I'd love to. Just let me know which topic or area of medicine you're interested in, and I can dive into that, whether it's a specific disease, pharmacology, diagnostics, or anything else. I'm here to help you out.
Your pharmacokinetics of
Got it. If you'd like to dive into the pharmacology of mycobacteria or specific drugs used to treat mycobacterial infections like
okay.
tuberculosis.
What about the pharmacology for leprae, microbacterial leprae?
Absolutely. So Mycobacterium leprae, the causative agent of leprosy, is typically treated with a combination of antibiotics. The main drugs used are dapsone, rifampicin, and clofazimine. Dapsone works by inhibiting the synthesis of dihydrofolic acid, which is crucial for bacterial DNA replication. Rifampicin inhibits bacterial RNA polymerase, blocking RNA synthesis, and thus preventing bacterial protein production. Clofazimine has both antimicrobial and anti-inflammatory properties. It binds to mycobacterial DNA, interfering with replication, and it also helps reduce inflammation in the skin and nerves. The combination of these drugs helps to prevent the development of resistance and effectively treat leprosy over time. If you want more details on any specific aspect or have more questions, just let me know.
Yes. Treatment options for NSAID-induced peptic ulcer.
Certainly, NSAID-induced peptic ulcers are a common issue, and the treatment typically involves a few key approaches. One, discontinuation or reduction of NSAIDs. The first step is usually to stop or reduce the NSAID that caused the ulcer, if possible. Sometimes a switch to a different pain management strategy is recommended. Two, proton pump inhibitors. These are often prescribed to reduce stomach acid and promote healing of the ulcer. Common PPIs include omeprazole, esomeprazole, and pantoprazole. Three, H2 receptor antagonists. These can also help reduce stomach acid and include medications like ranitidine or famotidine. Four, antacids and alginate preparations. These can provide symptomatic relief by neutralizing stomach acid and forming a receptive barrier over the ulcer. Protective agents, medications like sucralfate can help coat the ulcer and protect it from stomach acid, promoting healing. 6, antibiotics if there's an infection with Helicobacter pylori, which can also contribute to ulcers. Antibiotics such as clarithromycin and amoxicillin may be used. By combining these approaches, the ulcer can heal more effectively and prevent recurrence. If you'd like more details on any specific treatment or have further questions, just let me know.
What is URTI?
Infection, it refers to infections that affect the upper part of the respiratory system, which includes the nose, sinuses, pharynx, and larynx. Common examples of URTIs include the common cold, sinusitis, pharyngitis, and laryngitis. These infections are usually caused by viruses, but sometimes bacteria can be involved. Treatment often focuses on relieving symptoms, such as using decongestants, pain relievers, and rest. If you want more specific information or have any other questions, just let me know.
Yep. Which diseases relate to URTIs?
Upper respiratory tract infections, URTIs, can be linked to several common diseases and conditions. Some of the main ones include the common cold, usually caused by rhinoviruses. It's the most frequent type of URTI and involves symptoms like a runny nose, sore throat, and sneezing. 2, pharyngitis, inflammation of the pharynx, often caused by viruses like adenoviruses or sometimes by bacteria like group A streptococcus. 3, sinusitis, inflammation or infection of the sinuses, which can be viral, bacterial, or even fungal. 4, laryngitis, inflammation of the larynx, often caused by viral infections, virus or irritants. 5, influenza. While the flu primarily affects the lower respiratory tract as well, it often starts with upper respiratory symptoms. Tonsillitis, inflammation of the tonsils, which can be caused by viruses or bacteria like Streptococcus. These conditions are typically self-limiting if viral, but bacterial causes may require antibiotics. If you need more detailed info about any specific condition or treatment, just let me know.
चुप रहा था ना लवली इसमें कुछ बोलता हूँ नहीं तो क्यों बोलता है नहीं बोलता है इसमें
days, continue anti-diabetic drugs as advised by previous physician. To RA, 3 months. FBS, PPDS, attend casualty if needed. Diet, soft, bland, cold diet. Backside clinical notes. CC, passage of black colored stool, 2 episodes, 1 day. History, recently treated for URTI at Durga Clinic Hospital likely. PHO, Milena black stool positive. Known DM on OAs, oral antidiabetic drugs. Urine, normal OE, on examination. BP, 130 to 80 milliliters. Afebrile xanthelasma present. Yellowish eyelid patches often seen in lipid disorders. Shed Vice, investigations. CBC, complete blood count. UGI endoscopy plate pylori test. Stool for occult blood. HbA1c, RBS. Serum lipids, ECG chest, possibly written as N chest or M chest unclear. Summary in plain English. The patient, 55-year-old male diabetic, had black stools melena, likely indicating bleeding in the upper gastrointestinal tract. Doctor suspects a gastric ulcer or gastritis, possibly linked to medication or infection, H. pylori. Treatment includes exodectine, acid suppression, domperidone for reflux gastritis, fulvite active, vitamin B9 supplement, gut trap suspension, antacid protective syrup for stomach lining. Diet, soft, bland, non-spicy, preferably cold foods. Tests are advised to confirm the source of bleeding and check diabetes lipid control. Would you like me to give you a simplified daily medication schedule, e.g. morning, afternoon, evening plan?
What does random glucose suggest?
Hey there, I've got a really great feeling about us teaming up. How can I jump in and help?
I'm saying, what does random glucose suggest?
Random blood glucose levels help in assessing blood sugar at any given time, regardless of when the person last ate. It can indicate if someone has hyperglycemia, high blood sugar, or hypoglycemia, low blood sugar at that moment. For someone with diabetes, a random glucose test can help monitor how well their blood sugar is controlled throughout the day. It's not as precise as a fasting blood glucose test or an HbA1c, but it's still useful for quick checks.
What does elevated random glucose suggest? 240.
An elevated random blood glucose level, like 240 milligrams DL, usually suggests hyperglycemia, which can indicate poorly controlled diabetes or even undiagnosed diabetes. It could also happen due to factors like stress, illness, or certain medications. It's definitely something that needs follow-up with a healthcare provider to understand the underlying cause and to adjust treatment if needed.
What is glycated hemoglobin?
Glycated hemoglobin, often referred to as HbA1c, is
Yeah, continue. What is glycated? What is glycated? What is glycated hemoglobin? You can run in the background, man. What is glycated hemoglobin?
Got it. So glycated hemoglobin, or HbA1c, essentially shows the average blood glucose levels over the past 2 to 3 months. It's a valuable measure for managing diabetes because it gives a long-term view of blood sugar control rather than just a snapshot at one moment.
Okay. I mean, how is glycated hemoglobin formed?
Great question. Glycated hemoglobin forms bloodstream binds to hemoglobin, which is the protein in red blood cells that carries oxygen. This binding happens naturally and continuously as long as glucose is present in the blood. The higher the blood glucose levels over time, the more hemoglobin gets glycated. Because red blood cells live for about 120 days, the HbA1c level reflects the average glucose level during that period.
Come again, how is it formed?
Of course, so glycated hemoglobin is formed when glucose in your blood reacts with hemoglobin in red blood cells. This reaction happens naturally and continuously as long as there's glucose in the bloodstream. Over time, as red blood cells circulate for roughly 120 days, the amount of glucose attached to the hemoglobin builds up. This means that the HbA1c level effectively shows the average blood sugar over the past few months.
Okay, what are the types of hemoglobin?
The typical range for HbA1c in a non-diabetic person is usually below 5.7%. For someone with pre-diabetes, it typically ranges from 5.7% to 6.4%. And for those with diabetes, an HbA1c of 6.4% or higher is usually diagnostic. For people who already have diabetes, the target is often below 7%, but that can vary depending on individual circumstances.
Can someone with diabetes turn their HbA1c below 5.5?
In most cases, it's quite challenging for someone with diabetes to achieve an HbA1c below 5.5%.
No. I'm not talking about the diabetes. I'm talking about pre-diabetes.
Got it. That makes sense. For someone with prediabetes, it is definitely possible to bring the HbA1c below 5.5% through lifestyle changes like diet, exercise, and weight management. With consistent healthy habits, many people can revert from prediabetes back to normal glucose levels and keep their HbA1c in that healthy range.
Okay. How can one do it? Like which kind of food one should eat, and what are the other lifestyle changes?
Absolutely. For managing or reversing prediabetes, focusing on a balanced, healthy diet is key. That typically includes plenty of fiber-rich foods like vegetables, whole grains, and legumes, and also incorporating lean proteins and healthy fats. It's really helpful to limit refined sugars and processed foods, as well as sugary drinks. In terms of lifestyle changes, regular physical activity is super important, aiming for at least 150 minutes of moderate exercise per week, like brisk walking, cycling, or swimming. Also maintaining a healthy weight, managing stress, getting enough sleep, and staying hydrated all contribute as well. It's a holistic approach that can really make a big difference.
Okay. What about the what food should I eat and what food I should avoid?
Absolutely. So for foods to include, think plenty of non-starchy vegetables like leafy greens, broccoli, peppers, and carrots. Whole grains like quinoa, brown rice, and oats are great too. Lean proteins like chicken, fish, tofu, and legumes are also fantastic, and healthy fats like avocados, nuts, seeds, and olive oil are beneficial. On the flip side, it's best to limit refined carbohydrates like white bread, pastries, and sugary cereals. Also cut back on sugary drinks like soda and fruit juices, and be mindful of high sugar snacks and desserts. Overall, it's all about balance and making sustainable, healthy choices.
Where does rice stand?
Rice can definitely be part of a healthy diet, but it's good to choose whole grain options like brown rice or wild rice because they have more fiber and nutrients compared to white rice. If you have prediabetes or want to manage blood sugar levels, it's best to watch portion sizes and balance rice with plenty of non-starchy vegetables and protein. That way you keep your blood sugar stable while still enjoying rice in moderation.
Okay, what about white rice?
White rice compared to brown rice has had the bran and germ removed, so it's lower in fiber and nutrients. This can cause it to raise blood sugar levels more quickly. That said, it's still okay in moderation, especially if you balance it with high fiber foods and protein. Just being mindful of portion sizes and pairing it with other nutrient dense foods can help keep blood sugar levels stable.
Yeah, if one eats like white rice, what should eat to compensate it so that it doesn't lead to more increase in blood sugar?
Absolutely. To help balance out the effect of white rice on blood sugar, you can pair it with foods that are high in fiber and protein. For example, adding non-starchy vegetables like broccoli, spinach, or peppers can slow down digestion and help keep your blood sugar steady. Including a good source of lean protein like chicken, fish, tofu, or legumes also helps stabilize blood sugar. And healthy fats such as avocado, olive oil, or nuts can further slow the absorption of carbs. So combining white rice with these kinds of foods can definitely help your
Come again, come
blood
again. Can you repeat it?
Of course. So to balance out the effect of white rice on blood sugar, you can pair it with high fiber and protein-rich foods. For example,
Okay, continue.
sure. So adding non-starchy vegetables like broccoli, spinach, or peppers helps slow down digestion and keeps your blood sugar steadier. Also, including a good source of lean protein like chicken, fish, tofu, or legumes can help stabilize blood sugar as well. And adding healthy fats like avocado, olive oil, or nuts can further slow the absorption of carbs. By combining white rice with these kinds of foods, you'll help keep your blood sugar more stable overall. Absolutely. It's all about creating that balance so that the carbs are absorbed more slowly, and that helps keep your energy levels stable and your blood sugar in a healthier range. If you have any other questions or any more tips, just let me know.
What are the types of hemoglobin?
So when we talk about types of hemoglobin, the main one is hemoglobin A, which is the most common type in adults. Then there are variants like hemoglobin A2 and hemoglobin F, which is fetal hemoglobin found in babies. There are also some abnormal types like hemoglobin S, which is found in sickle cell disease, and hemoglobin C. Each type has a slightly different structure and function, and they can impact how oxygen is carried in the blood. If you're curious about any specific type, definitely let me know.
I mean, is HB1AC not a type of hemoglobin? Glycated hemoglobin?
Yes, exactly. HbA1c is actually a form of glycated hemoglobin. So it's not a separate type of hemoglobin in terms of structure. Instead, it's hemoglobin that's bonded to glucose. So, in essence, when we measure HbA1c, we're looking at the percentage of hemoglobin that's glycated, which reflects average blood sugar levels over time. It's a really helpful marker for monitoring long term glucose control.
Okay, I mean, what does
Absolutely. It can definitely be a big
what does if the glycated hemoglobin of a person is like 5? What does it mean like?
Great question. So, if someone has an HbA1c of about 5%, it generally means that their average blood sugar level over the past 2 to 3 months is within the normal range. Typically, an HbA1c below 5.7% is considered normal and indicates good blood sugar control. So, a 5% HbA1c is definitely a sign of healthy glucose levels, and not something to worry about.
Okay, no, that doesn't mean that 5% of his all hemoglobin is glycated. Doesn't mean that.
Exactly, you've got it. A 5% HbA1c means that about 5% of the hemoglobin in the blood is glycated. Not that all of it is. The rest of the hemoglobin remains non-glycated. So the HbA1c is just a percentage that reflects the average glucose exposure over time rather than a direct measurement of every single hemoglobin molecule.
Okay, what makes up the other percentage of hemoglobin, the other 95%?
Great question. The majority of hemoglobin in adults is actually hemoglobin A, which makes up about 95% or more of the total hemoglobin. The remaining percentage is usually made up of hemoglobin A2, which is about 2 to 3%, and a small amount of hemoglobin F, which is usually less than 1% in adults. There can also be tiny amounts of other hemoglobin variants, depending on genetic or certain conditions, but those are usually in very small quantities.
আমাদের পাড়ার বধি পালিয়ে গেছে পড়েছে ধরা দেখতে যাব আমি তুমি আমাদের পাড়ার দিয়ে গেছে
কি কইলে মিয়া জানে
No worries at all. I'm happy to explain anything further or clarify anything you're curious
okay
about.
Sajjabri
Just let.
time to sleep bye bye
Of course, no problem at all. If you have more questions later, just reach out. Have a great rest of your day and take care.
bye bye
Bye. Take care and have a great one.
কি কইলে মিয়া জানে কি কইলে মিয়া জানে
Out of tone, yo. I just jumped the band director. I got a band.
okay सारा जग छड़ के मैं तेनू ही मैं चुनिया सारा जग छड़ के मैं तेनू ही मैं चुनिया